PET-CT combines two different imaging technologies in a single scan: positron emission tomography, or PET for short, and computed tomography, or CT. Together, they result in a highly sensitive test that allows physiological changes to be precisely localized and evaluated at an early stage. PET measures the body's biological processes. CT generates high-resolution cross-sectional images of the body's anatomy. By combining both sets of information into a single, three-dimensional image, metabolic processes are mapped precisely and in all spatial dimensions. This helps to reveal the patient's condition at a very early stage. The combination of PET and CT gives a more accurate picture than the two scans performed separately, helping to facilitate a more accurate diagnosis. Physicians use PET-CT scans to aid in the detection of tumors and metastasis. Scans can also aid in distinguishing between malignant and benign changes at an early stage, determining the stage of a disease, developing a treatment strategy, and monitoring the response. PET-CT scans can also be used to evaluate Alzheimer's disease and heart disease. Metabolic activity is measured using so-called PET tracers. These are weakly radioactive biomolecules that behave like normal biomolecules and accumulate where needed. The PET scanner records an image of the tracer distribution as it collects in areas of higher metabolic activity, similar to cars gathering in a parking lot. These areas show up as bright spots on the PET scan. In principle, any biomolecule can be a tracer. Most often, however, radioactive labeled glucose is used, so-called 18F-FDG, which accumulates in tissues and organs with a high energy demand. Since the tracer decays quickly, it must be prepared anew before each examination. Before the PET-CT scan, the tracer is injected into a vein in the patient's arm. After that, the patient must rest for an hour to allow the substance to spread through their body. Then the examination takes place. CT uses X-rays and images multiple layers of the body in succession. The PET scan registers the decay of the tracer by means of the gamma rays emitted. A fused image is created from the dataset. (18F-FDG) glucose has a short half-life. After 2 hours, only half of the radioactivity remains. After 4 hours, only a quarter, and so on. The radiation dose from the two examinations corresponds, on average, to the annual natural background radiation to which every individual is exposed. At present, PET-CT scans are used to make mainly static images of the metabolic processes. The future will be dynamic imaging that captures and quantifies the metabolic processes over time. This will give physicians additional information to be able to diagnose, stage, treat, and monitor disease more effectively.